Hello, this is Matt Janucki, and you're listening to Season 2 of Inside Men's Mental Health, brought to you by Psych Sessions. Here we explore this thing called masculinity and its impact on men's mental health, relationships, and communities. We'll learn together through conversations with thought leaders, innovators, industry experts, as well as everyday men. Our conversations will help us understand how these individuals became interested in men's mental health and the ways their journeys have made them who they are today. Dr. Andy Smiler is a licensed therapist, speaker, and leading expert on masculinity and men's issues. He's authored multiple books, including Dating and Sex, a guide for the 21st century teen boy, The Masculine Self, Is Masculinity Toxic, a primer for the 21st century, Challenging Casanova, Beyond the Stereotype of the Promiscuous Young Male, as well as the recently released Clinical Work with Men. His research focuses on definitions of masculinity and normative male dating and sexual development. As a past president of the Society for the Psychology of Men and Masculinities, he's received numerous awards, including Clinician of the Year and Researcher of the Year. In his clinical practice, Andy works with teenage boys and adult men on issues including depression, anxiety, family conflict, gender identity, sexual orientation, and other mental health concerns through individual and family therapy. In this episode, we explore his newly published book, Clinical Work with Men, Understanding Masculinity in Psychotherapy. Andy shares his journey from community mental health work with teenage boys to eventually developing his Multifaceted Masculinity Framework, a four-part model examining how men internalize masculine rules, adopt masculine identities, earn or lose masculine status, and constantly negotiate the gap between the masculine ideal and everyday reality. The conversation digs into why working with male clients should be treated as a cultural competency and how therapists can build rapport with men right from the first session. Additionally, Andy challenges the cultural myth that men are psychologically simple, making a compelling case for recognizing the full complexity of men's inner lives. This was a fun conversation that I think you'll find helpful, whether you do clinical work with men, conduct research on the psychology of men, or just care about the mental health of men in your community. Thanks for listening and enjoy. Welcome to Inside Men's Mental Health. Today, the opportunity to have a conversation with Dr. Andrew Smiler. Recently wrote the book Clinical Work with Men, Understanding Masculinity in Psychotherapy. Andy, welcome to Inside Men's Mental Health. Great to talk with you today.
Thanks, Matt. It's great to be here and good to connect with you again.
Yeah, good to connect. Yeah, as we were saying just a minute ago, our paths have just converged a little bit over time through Division 51, APA, things like that. And so, yeah, nice to just have a chance to relax, have a conversation, and really highlight your work.
Yeah, thank you.
Well, one of the things I'm always curious about, Andy, is just when I have these conversations with folks is how'd you get into this work? So really just at what point in time and how did you think I'm interested in the psych of men and masculinities? I want to do work around men and masculinities. Maybe just talk a little bit about that.
Sure. My path was not a straight line, so
Feels
I
like it
got my
rarely
but
is, right?
right, but we always hear these stories that make it sound like it was.
Yeah.
So I got my clinical degree in 1993. I practiced on my master's, and for 5 years I did community mental health. I did a lot of therapy in people's houses and on the road, which
Okay.
was quite an experience.
And that's like
Um,
a counseling degree or social work degree or
so I have a master's in clinical psychology, which is a
clinical psychology.
degree
Okay.
that the APA kind of tried to get rid of, and now
Yeah.
they're trying to bring it
Bring it
back.
back. Yeah.
Yeah, I actually, back in the 90s when they were trying to get rid of it, I actually quit APA because I remember getting the monthly newspaper from APA,
Hmm.
and it was newspaper style.
Okay.
And there are like 2 months in a row or 2 months out of three where I read things about, APA defeated or whatever state branch of the APA defeated a proposal for master's level licensure, independent licensure for folks with my degree, a master's in clinical psych. And after the second or third time I read that, I thought, why am I giving these people money?
Hmm.
Um, and so I quit APA at that point. But I was doing community mental health work. I did it for 5 years. And somewhere in there, I decided that I'd rather teach than do therapy.
Okay.
And so I was fortunate enough to get into the program at the University of New Hampshire. And I specifically applied to UNH because they're one of about a dozen schools that really advertises as training folks to teach, not just training them to do research.
Okay.
And so while I was there, I went through their Preparing Future Faculty program, and I came out with a PhD in developmental psych.
Okay.
But while I was there, many formative things happened to me regarding your question. I think it was my second year in program. Our at the time hip young faculty member, Vicki Banyard, who was doing a lot of work on interpersonal violence prevention. She taught a course on psychogender,
Okay.
and this is about 99. It was around the time that, what was the book? Real Boys
Yeah.
by Bill Pollock had just come out. There were two others that weren't quite as prominent that also came out about the same time. Vicki, Dr. Banyard's teaching this course on psychogender, which was basically 14 weeks about girls and women and 1 week about boys and men. But in that 1 week about boys and men and reading a chapter from Bill Pollock's book, I was really intrigued. And was having this moment of, this is, the population I've been working with for the last
Yeah.
5 years, because in all of my jobs in community mental health, while I had several male colleagues, most of my male colleagues were interested in working with younger kids. And I was often the only male who wanted to work with teenage boys.
Okay.
So probably 75% of my caseload through those 5 years were teenage boys and their families. So I was really intrigued this 1 week in that psychogender course. And then I was at APA in Boston, which I think was 2000. It was just an hour drive down from New Hampshire. And I heard Jim Mahalik give an early presentation on the Conformity to Male Norms Index,
Yeah.
still in its development stage at that point. And then the next year, the convention was in San Francisco, and I went. And I started attending all of these sessions on working with boys and men, or just research on boys and men, that were sponsored by Division 51, the Society for the Psychology of Men and Masculinities. And there's a longer story here that I won't give you, but I ended up meeting Fred Rabinowitz, who was a past president.
Yeah.
At the time, I think he had just finished his presidency. And he kind of picked me out of the crowd because I asked a question, and he said, "You should come with me." And so that introduced me to both the research and the people behind the research on men and masculinities. And here I have stayed forever and ever, as I had a 10-year academic career and now back into private practice.
Yeah, I imagine. I
So
mean, a little bit of my story, but when I first, started to go to some Division 51 stuff, it was really important for me to see this community of people who really cared about boys and men. It sounds like for you that
yeah,
was important as you went
I,
to APA and you went to some of these talks, so you saw people like Jim Mahalik, Fred Rabinowitz, et cetera. Like you
yeah,
said, here's all of these other people that care about the same things that I do. And it seems like that was important
yeah.
for you.
Yeah, and it was great to have a community. The journal, Psychology of Men and Masculinities, was just starting at that point. So, as a graduate student, and my advisor didn't know anything about gender, didn't really think it was particularly important.
Hmm.
I could show her the literature, I could point to the organization. I'm a developmentalist, so I would go to the Society for Child Research, SRCD, Society for Research in Child Development, and Society for Research in Adolescence conferences. Very few folks there really doing gender-oriented work.
Mm.
And again, most of it towards girls. So to find my people who would, not just who were interested in what I was doing and could offer me support that way, but could point me to the literature, and could give me, for my dissertation, an external reader who was
Yeah.
familiar with that literature. That was all huge for me. It really told me and told my advisor that this was a legitimate field of study and a
Yeah.
legitimate thing to do. So
So
yeah, a little serendipity there.
Yeah, absolutely. It seems like that was really important. Yeah, that was important for me where, after getting to know some folks there where, I asked Chris Kilmartin to take part in my dissertation committee. Mine was on men's depression and he had done some work, some writing there, and like
Right.
to have somebody with that expertise that could give me support and guidance and yeah, kind of legitimize that field. Like, no, this is really something that is a legitimate academic area of inquiry, right? Was really important for me too. To
Yeah.
hear.
Yeah.
So at some point in time, you took a turn, right? You were doing academic work, you did PhD in developmental, but at some point in time you shifted back to clinical work. So I'm curious to hear a little bit about that, of what maybe led you back to doing full-time clinical work and the decision there. So tell me a little bit about it.
Sure. That was largely circumstantial, not so much planned, not
Okay.
exactly unplanned, but so while I was in my doc program, or actually, sorry, while I was in my postdoc, I met the woman that I was going to marry. I was doing postdoc at Michigan. She was living in Massachusetts and she was in law school. And she's also an academic. She's a law librarian. And so we had the crazy idea that, once we got married, we should actually live in the same place.
Sounds like a great idea.
Unfortunately,
Yeah.
it was not original. I will say that. Um, and not uncommon either.
Yeah.
Unfortunately, there are about 200 law schools in the US,
Yeah.
so not a lot of potential employers for her. Pretty much every four-year institution has a psych department.
Yeah.
And certainly you could do clinical work. I could do clinical work anywhere. So the radius of our search got bigger and bigger and bigger. And we ended up in North Carolina. She's in a permanent position. I was in a visiting position, but we got to live together and that was good. We were able to start a family.
Yeah.
But eventually it became clear that while I really wanted to be an academic, like academia wasn't for me. I was a full-time research. I was a researcher, and I very clearly at that time had a researcher's CV, but I
Yeah.
didn't have any external funding. I wasn't good at that. And there's not a lot of support for research that's explicitly on boys or men. And so I kind of got forced out and thought, well, I can do therapy again
Yeah.
and still do a little academic work on the side. And so I shifted back into the therapy lane, but continue to write. And the focus of my writing has shifted because I am self-employed and as my own boss, I don't really care if I publish in an academic journal.
Yeah.
Um, but as a clinician who works with guys and who sees the field and hears guys' stories about having bad experiences in therapy or not being able to connect with a therapist, I thought I should not be writing for just academics who get peer-reviewed journals, but for more, in this case, a clinical audience with the current book, but even some of my other work, writing for more general audience. And so that helps me stay in the research and
Yeah.
continue to write, but without having to go through all of the hoops of peer review.
Sounds like a nice formula, and it seems like you've really figured out a way to merge those worlds. I mean, when I see things like you're a very productive writer, and engaged, like professionally at the national level. And I've thought before, like, man, how is Andy doing all that? How are you seeing clients, and then also doing all of this writing and publishing and engaging, right? But I'm impressed, right, that you figured out a way to kind of merge these worlds in a way of writing and engaging in a way that engages in the broader discipline, right? But also continuing to engage in clinical work in a way that sounds like is fulfilling for you, but
Yeah.
also is really beneficial for a lot of people that continue to engage in your work. So, yeah, I see that and just think like, man, how's he doing it?
At this point, it's just what I do. There's a number of strategies and whatnot. I'm
Yeah,
very organized, which definitely helps, but it also just kind of feels natural. Like, and I talk to to colleagues who are in practices who see more clients than I do.
Yeah.
And I wonder the same thing, like how do you see 30 people a week
Oh,
or
yeah, yeah.
folks that have research labs, right? And they have 5 graduate students and 12 projects and they're on 17, you know, or not 17, but they're on 3 dissertation committees in addition to their own students. And like I like the variety that I have. I
Yeah.
can't imagine, just being the full-time academic or the full-time clinician.
Yeah.
And I think the variety is part of the key for me.
Yeah. Yeah, that makes sense. Well, let's talk about this book that's just come out, Clinical Work with Men. So, talk a little bit about what led you to do this work and engage in this project. Just overall, kind of why you wanted to do this work.
Sure, that's a great question. There are really two things, or at least I'm going to say two now, and by the
Okay,
time I stop talking, it might be 4 or 5. But
that's fine.
two things that really compelled me to write this book. One is just my own awareness that having been part of the research on men and masculinities and reading research on men and masculinities, I am aware, like, I know way more about boys and men and masculinity than most folks do.
Yeah,
And while that's lovely for me, like what we as a division, what we as a research area or focus area really need to do is get the word out. And so, as you mentioned, a lot of my work the last 10 years has been about kind of translating the research. And at the same time, just paying attention to the field. I own a small group practice. So in my own experience of trying to hire as clients, are come into my office and meeting new clients, right? Hearing stories about men having just okay experiences in therapy. And hearing men talk about feeling misunderstood. Certainly reading some of the research on why men don't persist in therapy, right? We see some of those
yeah,
themes. And then knowing also that the field is about 80% female, that the percentage of women in the field has continued to increase for the last 20 or 30 years and will continue to increase based on current enrollments and projected enrollments, knowing that their faculty are primarily female. For me, some of this book is really kind of trying to help female clinicians be culturally competent in working with men. Right? They don't, to the extent that psych of gender gets taught in graduate training programs, clinical training programs, right? My suspicion is that it's still mostly psych of women, like my
mm,
own experience in graduate school. And while I do understand like the intersectional point and that we need to teach female students about the whole range of women, we also need to teach them about the whole range of men. And that's not really happening. There are the 1 or 2 books that talk about doing therapy with men that really get into some of the detail. Some of those are 20, 30 years old. I don't know if
right.
you read Gary Brooks's book
Yep.
on doing therapy with men, and the exact title is escaping me in this moment. But I believe that is now 30 years old. I think that was a
Mm-hmm.
1995 or 1996
Mm-hmm. Yeah,
publication.
late 90s. Yeah.
Yeah. So part of writing this book for me and part of presenting 7 case studies and getting really detailed was about being able to present a range of men and a range of issues, and in some ways a range of approaches, a range of things that I did as a therapist, and the ways that they come across as a little bit specific to men, or this is how I did it with men, which might be a little bit different than how you would work with someone who identifies as female or someone who's trans.
You said that a minute ago of like working with men, psychotherapy with men, engaging with men as like a cultural competency. Do you
Yeah.
do you your experience like both in the field and both just kind of engaging in the broader profession, do you see that of working with men as something that's a cultural competency is still something that's a bit I can't think of the right I think a bit edgy is kind of the only thing that comes to mind, but still something that's kind of
Controversial.
on the fringes maybe of cultural competency of thinking of that.
Yeah. I think it's a little bit controversial. I don't think that the folks who, spend a lot of time talking about cultural competence really think about men or working with men as an area for that. But it's part of the reason that in 2018, APA published, guidelines for psychological practice
Yeah.
with men, right? And that's not just clinical practice; that's all psychological practice. Um, because the organization, right, and arguably the leading mental health organization here in the U.S., they said they recognize that services for men are not where they should be, right? And so, here's 10 guidelines, things for practitioners to really think about as you're working with male clients, or as you're, if you're an industrial organizational setting,
Yeah.
psychologist, in your setting with, perhaps primarily a male workforce, or perhaps men as a small percentage of the workforce. We think about, say, an educational setting. For me, a lot of the thought on this really comes from Will Liu, who in 2005 published an article arguing for, working with men as an area of cultural competence. And he did a much better job than I would ever do of laying out all the ways in which, kind of in everyday culture, we talk about men and women as being different, right?
Yeah.
I have my issues with John Gray, but this idea that men are from Mars and women are from Venus, it really points to this idea that men grow up in a culture that is distinct from the culture that women grow up, at least partly. And so if that's real, and John Gray certainly sold enough books, created a Broadway show based on his books.
Right.
Right? This idea has a lot of resonance in our culture. We certainly see it if in the media, right? There are segments of the media world that are heavily skewed towards men, segments that are
Yeah.
heavily skewed towards women. We know, right? We know that the audience for professional sports is mostly men. So, like, okay, how do we then work that into practice? How do we acknowledge that? It might influence your choice of metaphors. For me, it influences how I get to know a client the first 10 or 15 minutes before we get to the problem stuff. I will often ask them if they have a sport and who their teams are, right? And for me,
Yeah.
like you, right? I live in Winston-Salem, North Carolina. We do not have a team. We have a college team in this
Yep.
city. It's the home of Wake Forest University. North Carolina is largely a college team state, not so much professional team. We do have a couple of professional teams. They're an hour and a half away. I ask my clients how they chose their team, and that says something about loyalties. Maybe it's their parents' college team, or somebody else in the family. Maybe it's just star players, but it's a question that for the guys who follow sports gets them talking about their lives, and often tells me something about what's important to them, right? Either this institution is important to them, or this town, or this player, and you know, they start to open up, and they're opening up about something that they're already comfortable talking with, and something that, at least at the surface level, is usually pretty benign, which is part of what we want in those first 10 or 15 minutes,
Yeah.
right? We don't want to start off with the hard stuff. We want to start off with something easy. So, right, that's part of being culturally competent. It's knowing that there's this thing that I can probably talk about with my clients to help them just start talking before we get to the hard stuff.
Yeah, that's a great example to give an example of what that would look like to be sensitive, right, to these guys
Right.
that come in and to try and build rapport, build a relationship
Yep.
with them, help them feel comfortable. So yeah, thank you for that. What it kind of makes me think of too is like this tension between, like the men need to change to, engage in therapy, or we need to change the therapy to engage the men, right? And I feel some of this tension, the sense of like, well, the guys need to come in and they need to open up, they need to talk about their feelings and things like that. And if they just were able to do that more, then they would experience more benefits from therapy. Or they wouldn't drop out so early if they would just, like just kind of stick in it longer. with the alternative tension, right? Of like perhaps what we needed to think about is we need to change our models in our therapeutic approaches, right, et cetera,
Yeah.
things like that. And there's a range of ways to think about that, but some of what I hear about with you, right, is how you're very sensitive to this person in front of you, and you're willing to, within your model and within your frame, right, to adapt that approach to like help him feel comfortable with your questions, with what you do with him, et cetera. And I get a sense of that in your book, right, that you're willing to adapt what you do in order to help this guy engage in the process. That the therapeutic process essentially can be adaptive. Am I
Yeah,
summarizing some of that? I'm
absolutely.
curious, like your thoughts on that tension.
No, absolutely. So I'll start at the end and then work
Yeah,
backwards.
yeah. I know I threw a lot
You
at you
know,
there,
I
Andy. Apologies for that.
right, right. And so for me in my training program in the early 90s, but I think this is part of what we hear in cultural competence, right? Like we are supposed to adapt to our clients' needs, right? Like, yes, I have my thing, right? Like my initial training was in cognitive therapy. It wasn't even cognitive behavioral therapy then. It was still
Mm,
cognitive
that dates you
therapy.
then. Yep.
Yeah, right. 93. Like, okay, that's what we were taught is that like this is the framework in your head, and this is how you understand who the client is and what the client needs. But you may present that very differently from one client to the next, right? One client
Yeah.
may be very rational, one client may be very emotional, and you have to be able to work with both of them, right? And so your verbiage and what you emphasize like that's going to vary from one client to the next. And I think in some ways, like, we're talking about me shifting my approach slightly based on who comes in, but that's what I was taught was fundamental to therapy coming right out of Rogers. So there is that. And I think we all do that to some extent. But again, if we think about this as cultural competence, right? Like for a client, for a therapist who works with clients of all genders, because I only see males,
Yeah.
um, this might require some thinking about, okay, in that first 10 or 15 minutes of rapport building, like I need to remember to ask him about his teams because he's a guy and there's a reasonable chance that he has teams that he follows. Um, that might not be part of their standard question for working with women. So it prompts us to think about different sets of things more broadly, again, like we're supposed to meet our clients where they're at.
Yeah.
And that might require us to change how we did therapy. Again, I got my therapy degree in 1993. Like for the faculty who taught me, most of them had shifted their practice at least a little bit to address the needs of girls and women in the 70s and
Mm,
80s when we
yep.
started talking about cultural competence with
Yep.
girls and women because it was a male dominated field. My faculty were about 50-50, as I recall. But, like we as a field have done this before and we continue to do it, right? We have practice guidelines for based on sexual orientation. We have practical guidelines for trans folk. We also have practice guidelines for working with people from different economic statuses, right? And the way we talk to somebody who's relatively well off might be very different, is probably very different than the way we talk to somebody who, is in an hourly job and didn't go to college, right?
Yeah.
As practitioners, we might change our language, we might present concepts differently. We're certainly gonna, one of those clients has a lot more resources than another, right? And we would think about all that. Again, I don't think that this is anything earth-shattering, except that
Right.
it's thinking about it in terms of, how I work with boys and men.
Yeah, that's great to frame that in the broader context of just the many components of culture, right, that we think
Right.
about, right, and masculinity being just one of those components, right, and that makes it feel a little less edgy, right? Makes it
Yeah,
sound kind of
yeah.
normal. Yeah,
Yeah, like, oh, right. I guess that's kind of obvious there. Now that you say it like that, but the idea that we are doing something that is unique and specific to boys and men well, kind of parenthetically by itself or by themselves, like some people, really struggle with that
Yeah.
because on the macro scale, right, there are lots of ways in which men have more cultural power, have
Yeah.
more money than women. And that is true for a certain group of men, but that is not true for all
All men.
men,
Yeah.
right? And I don't have that clientele here in Winston-Salem, so most of the guys I see, like, they're in lots of ways regular guys. I mean, yes, some of them are doctors, some of them are auto mechanics, and again, as a provider, I want to, be able to meet anybody's needs.
A little pivot, Andy. So one of the things that I think is to highlight your book a little bit more, just helpful that you provide, right, is this framework that you integrate and then implement throughout the book, and that's this multifaceted masculinity framework. And just because of its helpfulness and uniqueness, just wondering if you could talk a little bit about that and just help people who are listening to this maybe understand just a little bit of what that is, and that might give them just a little like teaser trailer of like, okay, I want to get this book, I want to read it a little
Buy
bit
the
more.
book.
Yeah, right. But I thought it was helpful in the way that you then you have cases and you show how to implement this in these cases
Right.
was a real helpful approach. Maybe you could just talk a little bit about what this is.
Sure. And thank you for the compliment there.
Yeah, yeah.
I'm a big believer in
It's a genuine
theory and that
compliment.
theory, thank you. And that theory should help guide us, so guide our understanding, guide our practice. Kind of as I was sitting down to write the book, I realized, okay, I need a theory chapter.
Yeah.
And I was looking at the theories that are out there and the various approaches to, understanding boys and men that have been out there. And at some point it dawned on me, I don't want to pick one of these. I want to have all of them.
Mm,
And so then I started to construct this framework, now called the Multifaceted Masculinity Framework, MFMF. You might choose some other MFs to stick in there. Um, and it's really this kind of overarching structure that talks about how the different theories we already have kind of relate to each other. And these theories, so there's groups of theories that kind of compete with each other that all focus on one thing, and then there's
yeah.
theories that focus on another one. So I identified 4 facets, and I'm going to go through these in the order that is most comfortable to explain them. I don't
Yeah.
think any one is
Sounds
more
great.
important than the others. So the first one of these is masculine criteria. And this is the stuff that kind of we all know and recognize as things that men should do and things that men should not do, right? We should be tough. We should not be feminine. We should protect others. We should not, lose our cool in a crisis,
Yeah.
right? In everyday culture, we talk about these things as the man box
Yeah.
or it's your man card, right? Lots of references to this in the research. We've measured this as masculine traits or masculinity ideology. But I just kind of lump these all together. These are my masculine criteria. These are the rules for being a guy. Another facet are masculine types. This refers to pre-existing images, identities, and stereotypes of how boys and men can be. I've already kind of given away my age here. I graduated in 1986. So as someone who was of that era, I am going to refer to the Breakfast Club, right? We have the our
Yeah.
five
Yeah.
teenagers in detention there, Saturday detention, right? The 3 images, identities, stereotypes of boys there. We get the jock, we get the rebel, we get the nerd. For the girls, we get the princess in the basket case, right? And those images stay today, right? If you're continuing with the adolescent movies, right? You watched High School Musical in the early
Hmm.
2000s. It answers the central question of whether or not the jock can hang with the theater kids,
Hmm.
right? More recently, if you're a fan of Mean Girls, we get the tour through the cafeteria with,
Oh
again,
yeah.
all the same kinds of labels. There's lots of reasons that those labels persist, but what they do for teenagers developing their identity, even young adults, folks in midlife, maybe having a crisis, right? They give us this preset version of what your life could look like, right? And folks might lean into one in particular. They might move away from it. They might just recognize, oh, this is what I do, and it fits that image. So I guess that's the label I should adopt for myself, right? So these are masculine types.
Okay.
So we have masculine criteria, masculine types, and then the third facet that I talk about in the book is masculine achievement. This is what you get for adhering to the criteria or adhering to your type particularly well, right? We might say, you know, he's man enough, or if you're doing it really well, we might talk about him as the man. Or if you're really struggling with that, we might talk about it as guys failing at manhood.
Yeah.
Right? We talk about, in everyday culture, we talk about guys getting punches on their man card.
Yep.
The big research paradigm here comes from social psychologists Joseph Bandello and Jennifer Bosson, who developed the precarious manhood research paradigm, right? And you know, all of this achievement stuff, this is about status, right? That's proving that you're man enough. And they tagged it's the title of one of their articles that manhood is hard won and easily lost.
Lost. Yep. That's
right. Because it's not just you prove it once, but like you got to prove it again and again and again. Other folks, my friend and colleague Chris Regaluth, author of the Masculinity Workbook for Teen Boys, he talks about policing masculinity, right? And the ways that, you know, on a very small scale, typically peers enforce these kind of masculine criteria or masculine types. So there's all, but in one way or another, it all comes back to achieving status as a man, proving you're man enough. So we have criteria, we have types, we have masculine achievement. And then the fourth and final facet are masculine negotiations. This refers to two things, but it's largely about the differences or the efforts to achieve, you know, what's the version of masculinity in my head, and then what can I actually do, right? And what I can actually do might be about a guy's particular skills and attributes or whatnot, but it might also really be environmental. I'm a big fan of the NHL. I like pro hockey. You know, at age 6, 7, I really wanted to be a hockey player.
Yeah.
But I'm not actually that athletic. And as the third child of a single mom in the 70s, growing up in the Philadelphia area where you have to pay for your ice time and you have to be able to get to the rink, that just wasn't happening.
Yep.
So both, you know, for me personally and then economically, this was not a choice. I was 7. Like I wasn't that disappointed that I wasn't going to, you know, that I didn't become a hockey player. It wasn't that big of a dream or anything. But, you know, we negotiate those things a lot. I always want to say all of the time there. Like if there's some point where we just settle in and it is what it is.
Yeah.
But, you know, certainly in high school, right, all of the peer stuff pushes us to maybe do certain things and not do other things. You know, entering the workforce, whether that's happening in the teen years or in the 20s, you know, what are the jobs available? If you really identify with the protector role, which for me would be a masculine type, you know, provider role, you know, what are the jobs available in my area? Am I willing to move or not?
Yeah.
Right. Like that may very well influence how much of a provider you can be. All right. So there are these negotiations that we do all the time. And for us as therapists, right, in a lot of ways, therapy is about helping people negotiate or renegotiate their lives. What do you want to do? Is that working for you? How can we get you there? So that's, you know, one of the places where this model also readily connects to what we do as therapists.
Yeah, I think what's helpful, right, is not just the model that you provide, right, to give a frame to think about this with men, is you have a range of cases where you implement this and show what's your decision making around this and the way that you engage with these different guys, these different types, and what's some of the, you know, you even provide some of the conversation that goes on between you and these guys, and and it's a pretty wide range of cases, and there's a lot of intersectionality around these cases too, right? So it's not just like 8 case studies of middle-aged, middle income,
Right.
white Protestant. I don't know, like I'm talking about,
Yeah.
right? And so you clearly chose a way to like demonstrate your work and implementation and the way you think about these cases with a range of different kind of guys that show up in therapy, but also just a range of different kinds of guys just generally, right?
Yeah.
And I wonder if you can just talk a little bit about that for just a minute of just your decision making and thinking of these cases, because I think that's really helpful, right? That in the practicality of this book, right, where
Hmm.
people can see like how do I not just see this theory, but how do I maybe work it
Use
out
it.
with guys that come into my practice? So maybe you can just talk about that. Just how do you think about these cases and in order to help people understand how to work with men?
Sure. And I'll do the full overview of the book here because
Yeah,
we're
yeah.
working through it here.
That sounds great.
So the first chapter of the book is a little bit of this cultural competence argument. The second chapter spells out the theory, and then there are 7 chapters, 3 through 9, that present these case studies. And each of those chapters opens with some dialogue, and then I discuss kind of what I'm hearing in that dialogue and what the client's concern is, why the client has come into therapy. And then I break it down in terms of the MFMF, talk about criteria and types and achievement. And then we get a second segment of dialogue that's usually a couple months or a couple years later to show some
Yeah,
progress and go through some more of that and the treatment issues and in essence doing some treatment planning, saying
yeah,
these are the issues we worked on. In thinking about the book and selecting cases, I was very deliberate in trying to choose men, again, with a variety of identities, different racial and ethnic backgrounds, different sexual orientations, different income levels and
yeah,
education levels, different ages.
yeah,
Um, because, working with the publisher, which is actually the American Psychological Association, they were very clear that they needed me to be 18 and up for this because I was presenting cases from real life, although all the cases that I present are amalgamated. They're all based on 2 or 3 clients,
yeah.
but had I gone under 18, that's a whole additional set of
Sure.
permissions that we don't want to deal with. So it's just 18 and up, but a lot of it gives you an example for how you might work with teens as well. And I wanted to show off a range of issues. And in writing the book and conceptualizing the book, I wanted to be a book that folks can just drop in and out of, right?
Mm.
Like I want everybody to read the first 2 chapters. I want them to understand this cultural competence argument and support, a push for better training for therapists and working with men. I really want them to understand the model and use the model. And then there's 7 case studies that folks can read in any order. And they're all titled in ways that make it, that I tried to make it very clear what the chapter is going to be about. So I talk about a man who's a provider. I talked about a man who's a protector. Another man who's very unemotional, right? So like you can look at the table of contents and be like, oh, that reminds me of a client I'm working with right now. Whether you're a student and you're working with your first clients, or whether you've been a therapist for 30 or 40 years, and there's a man in your practice that you're struggling with a little bit. Like once you got the theory, you can just drop in wherever you need to in
Yeah.
the book.
Yeah, that's a great way to think about that, where it's something you could just think of, okay, here's this guy that I'm working with. So I'm going to go through and look at it, get some guidance, get some support, revisit the theory part, right? And look at the theory. So it's
Right.
something that could very much be a resource that you could drop in, drop out of, drop back into, drop out of. I like that frame, Andy. That's helpful.
Yeah, yeah, thanks. Yeah, and so then, right, kind of as needed, like, oh, I have this guy who's a player, right, a promiscuous guy, right? I don't see many of them. Like, let me get some sense of
Yeah.
what that might look like. And in each of those chapters, right, a lot of the chapters case study, but then there's also places where I talk about, these are strengths that are kind of inherent to that type.
Yeah.
And these are some of the weaknesses. And for a lot of I think for all of them or almost all of the case studies, I also do a little bit of history about where this masculine type comes from and how it may have changed over the years. So I'll stay with the player because that was my first book, Challenging Casanova Beyond the
Yeah.
Stereotype of the Promiscuous Young Male. Like prior to the 1970s, like, we did not think that a guy could engage in promiscuous sex and be a good guy. Right now, 50 years later, that's kind of fundamental, right? We have all of these popular sitcoms with, multiple young men, or one of them is a player, right? We have Barney on How I Met Your Mother. We have Joey on Friends, right? We don't think twice about that. But prior to about 1970, we didn't see that character on sitcoms,
Mm.
right? So that's a shift in the culture. When I talk about providers, I talk about a little bit about what providing meant, say, 100 years ago when we were in the transition from being an agrarian culture to an industrial culture, and what it is now. And similarly, right, in the chapter, I talk about men who describe themselves as unemotional. I talk about that evolution as well, because I remember being in high school and learning about the Romantic poets,
Hmm.
the whole Romantic movement, right? And those were mostly male authors.
Yeah. Yeah.
Um, Shakespeare, say what you want about Shakespeare. Some people love him, some people hate him, some people are tired of hearing about him, right? Shakespeare is famous for love sonnets, for, all of these plays that drive a lot of emotion. And it's a guy,
Yeah.
right? And he writes emotional men. We didn't always think about men as unemotional.
Yeah.
That is relatively new since the industrial era in our culture.
Yeah. Interesting to think about that from a longitudinal perspective. Yeah.
Right. And
Oh,
even, one of the things, I'm a white guy. Again, some of the guys I work with are highly educated, some are not. Like some of my clients, at least my white clients, like if they've watched a lot of media, like I will ask them, if their stereotype of Italian men is emotional, right? Right. Like we've seen The Godfather, right? We've seen all these movies with Italian men, right? Big emotions,
yeah.
talking with their hands, right? Like,
Yeah.
and again, in The Godfather, we see Don Corleone, Marlon Brando's character, right? We see him cry. We see
Yeah.
him upset, particularly when his oldest son, Sonny,
Dies.
dies.
Yeah.
But at other times as well, like we had a really broad range from this extremely violent character, right? So like if this is our stereotype of Italian men, then for me as a white guy, like clearly white men can be emotional,
Mm.
right? I might do some other unpacking of that stereotype, I
Yeah.
might not, depending on the situation, right? But clearly men can be emotional, and there are men that we look up to, something there, who do that, and we're fine with it. In fact, we give them Academy Awards for the writing and for the movie.
Yeah.
Um,
Yeah. I'm thinking of the, I can't think of an exact context that comes to mind or example that comes to mind, but I'm thinking of the time, where we see athletes that are tearful, they've lost the game and how
right.
that can be. Granted, I've also seen some examples of where athletes have been tearful and like they've been judged for that too,
Uh-huh.
but I think that's one example where, men can be moved by that, like this person has put
Absolutely.
so much on the line and they've given so much and they either they've lost or they've won, right? And they're tearful in that moment and
Right.
how many men can be moved by that expression of
Yeah.
emotion.
Yeah. A lot of guys talk about, what it's like to see their child born, or
Mm,
hold their
yeah.
child for the first time. And, again, that kind of stirring of emotion. And, within American culture, being allowed to be emotional because we have this
Yeah.
stereotype that men should not be emotional.
I have a question for you about your book. Now, this is a question that I'm throwing this a left field for you, Andy.
That's fine.
And in the end, you might say like, I don't know, I didn't have any choice in this or whatever, and that's okay. I'll just take it out, I'll just delete it. I'm wondering about the cover, the image on the cover, and like if that's something that you kind of had some thought into or say into, and any rationale for that. Like I can see it right now behind you. I can see the
Right.
man leaning
Right.
over,
Right up
thinker
there.
kind of man. Yeah, right. I'm wondering if there's any background to like that image that you provide can provide any insight into. I've got the author on the hook here, so any background for that?
Not nearly as much as I would like, really.
Mm,
I am not a particularly visual person. So there's a process when you're writing a book and working with a publisher where they say, okay, do you have any thoughts about what should go on the cover? And my answer is always no, please give me some ideas.
okay.
And so the publishing API, I imagine all publishing houses have somebody on staff that generates art and generates images. And so they came back to me with 4 or 6 images, and I really liked this one. We ended up tweaking it a little bit, but for me, it's brings up images of Rodin's thinker, but it's this nice male form. As someone who's not particularly visual, I tend to prefer simpler visuals
Yeah.
anyway. Right, so it's eye-catching, clearly a male form. You might go to Rodin and see he's thinking. You might look at that and say he looks like he might be in pain or struggling with something, which seems appropriate for a book about doing therapy with men.
Yeah.
They're not coming because their lives are great. So that's where the image came from, but I did not initiate it in any way. There's somebody else who does visuals who said, okay, therapy with men. What can we do with that?
I like that though. Like you did choose this. You liked this, and there's some things about the clearly male, like some male form, but also just the contemplative piece or whatever it is. This man is he's
Yeah.
experiencing something, and it's a bit Rorschach-y, right? Like what is he
Yeah.
experiencing, right? That could be up to you, right? Like is it positive? Is it negative? Is it contemplative? Is it painful, right? And so
Right.
that's a bit up to the reader, the viewer, in that appeal to you. So thanks. Yeah, I'd like to
Yeah.
hear that.
Yeah. It fits. It's always a kind of fun and interesting moment for me when I get back. Here are the covers that we're thinking about for your book. Because it's so, again, I'm not a particularly visual person, and so it's not my thing, right? And then there's this graphic designer, artist, whatever their background is exactly, who has the name of the book, who maybe has like a 1 paragraph blurb, but
Yeah,
the book is still in progress, so like we don't have the content for the back cover yet. And based on the name and maybe a paragraph of description, like they create some image that's going to communicate what this is. And so it's kind of fascinating for me at this point, when
sure.
we come back with that.
No,
Yeah,
good
so
for you.
sometimes there's a little bit of like, okay, I like these three. I don't know where that other one came from. Like,
Yeah.
but so far with all my books, there's always been one that I really like, and so that's been nice.
Yeah, and I just again looking at it, I kind of like it's a very simple kind of aesthetic, right? Like there's not a
Yeah.
lot going on the cover. Like it's the title's clear, the image is clear, there's a lot in that white background that makes everything else stand out. Like the blues stand out, and the blue's not a bright blue, it's kind of a muted blue. Like it's a nice look. Yeah.
Yeah. The graphic designer did a great job. So
Well,
let's hear it for experts in other fields.
yeah, it takes a team. I can't
That's
imagine. I'm
right.
sure it takes a lot of folks. I've never written a book, but I imagine since you've written several, it takes a lot of folks to do it.
Yes. And I have been fortunate to have good editors throughout as well who really helped me clarify like what is the point that I'm trying to
Mm,
get across in this particular chapter or this
yeah,
segment of the chapter. And copy editors who make me sound like I'm fluent in English or at least can write well. So lots of help, yeah.
Well, kind of as we get towards the end of our time, we've unpacked multiple parts of your book, the kind of the purpose of it, some different components of it that you thought were important that can be helpful for people who engage with this. Anything else, Andy, that you think like that we haven't hit, that we haven't captured, that would be helpful to bring out and highlight for people that are interested in this that we haven't hit today?
No, I think we've done a good job of talking through the book and the multifaceted masculinity framework and describing how that might be used. The big, if there's nothing else that our fellow clinicians remember from this, or other folks who are watching and listening, the big thing for me is just this idea that men are complicated.
Mm,
And again, one of the ways we talk about men in America today is that guys are simple.
mm-hmm.
Women are complicated, but guys are
Yeah.
simple. That's crap. Men are complicated. There's lots of things we want to happen for ourselves, for our families, if we have families, for our partners, if we have a partner. And it is tough to make all those things happen, right? We might need new skills, we might need to relocate, whatever. We might need to do a lot of shifting. Men are complicated. And I think we need to remember that and treat them that way, not just as kind of simple stereotypes that we see a lot.
That's great. I think that's a great place to end, Andy. I'm glad that you were able to add that in. I think that piece is important.
Thanks.
Well, it's been a pleasure. It's been a lot of fun today. I really enjoyed this conversation. Yeah, thanks for that opportunity. Yeah,
Yeah.
this definitely be the this will be the highlight of my day, highlight of my week, and so it's been a lot of
Thank
fun.
you. Yeah, thanks, Matt. It's good to see you again and catch up a bit. Thank you for having me on the show.
Good to connect, and
Yeah,
hopefully it won't be so long before we connect again.
yeah, absolutely. Thanks, Matt. I appreciate the invite, and I look forward to hearing the final product.
Yeah, sounds good. We'll have a great weekend, and
Thanks, you
yeah,
too.
see ya. Bye, Andy.
Bye.